New COVID-19 cases and hospitalizations are still rising, putting Montana among the highest in the nation per capita in both categories. We are also getting closer to the COVID-19 numbers hit during the last fall's peak wave of COVID-19 before vaccines were released in January. So how is Governor Greg Gianforte's administration responding to this surge? And how does his response compare to actions taken last year by his predecessor, then Governor Steve Bullock? MTN chief political reporter Mike Dennison spoke to people who worked closely on the issue during both times. And here's part one of his two-part series.
As the COVID-19 pandemic unfolded last spring and summer, then Governor Steve Bullock invoked a state of emergency, closed schools, temporarily restricted public gatherings, and mandated face masks in many public places. Yet COVID numbers still surged in the fall, hitting almost 1,000 new cases a day last November and 312 deaths, the highest of any month so far in Montana. Jim Murphy was the state epidemiologist under Bullock and Gianforte until this June, when he retired. He says while Bullock's orders faced resistance in some locales, Montana fared better on infections, deaths, and hospitalizations than neighboring states that didn't invoke similar restrictions last year.
So when you compare the rates for those states, we know that the measures that were put into place in Montana worked. Had Montana public health folks and the governor's office not stepped forward to do those things would have been much, much worse than they were, and they were bad enough.
Bullock also held frequent news conferences on his pandemic plans, fielding questions from reporters and sharing the stage with key health staff, hospital officials, and others. Greg Holtzman was state medical officer under Bullock and a key advisor last year.
He made it very clear in the beginning he wanted to be transparent. He knew that things would be a little mucky because things were just changing so quickly.
Ellen Leahy, the longtime public health director in Missoula County until she retired this summer, says local health officers weren't always in the loop initially and sometimes disagreed with Bullock's directives. But she says he left them some flexibility to implement those rules and provided visible leadership when the state needed it.
So to have the governor, the top elected official, show that leadership, sent so many nonverbal messages, says, hey, this is important. Hey, we are all one state. But at the same time, he would always say, sometimes we didn't like it, but he would always say, talk to your local health department.
Gianforte became governor in January as the pandemic was still raging, but vaccines were on the horizon. Health officials generally give Gianforte good marks for prioritizing the vaccine rollout and personally encouraging Montanans to get vaccinated against COVID-19. Yet, as this year has unfolded and COVID-19 cases and hospitalizations surged anew in Montana, they say actions or inactions by the governor and his administration are not always what they consider helpful.
There were a number of bills that he signed off on that made really drastic changes to our local control public health system in the state. It took away fundamental tools for times just like this and did it in the midst of a pandemic, which I think was reckless.
We'll talk about some of those laws and actions tomorrow. We'll also hear from Gianforte's top health official on just how the administration is responding to that criticism and to the recent surge in COVID-19 cases. Reporting from Helena, Mike Dennison, MTN News.